So this is actually my mouth here. We got a digital scan. And then we're just going to imagine that we took all the teeth out. And then we've got this ridge here to work with. So that's a nice healthy ridge, something for a denture to sit on. So just some of the things I want to show you about a denture. One, we've got all of this material here, the palate. So that's going to sit on the roof of the mouth, and it's going to extend way back here. So this is going to be what we call the posterior palatal seal, and it kind of looks like a little Cupid's bow there. So if you took your finger and ran it across the roof of your mouth, all of this is going to be hard. This is the hard palate, and then you're going to get back here, and then you're going to be able to push it in a little bit. It's going to get soft. This is the soft palate. The denture and the ability to kind of give you a suction cup effect is going to rely on this area here. So it's going to have to extend all the way back here. And that's going to cause a lot of problems for a lot of people. One of the things that this causes is gag reflex, which is a big one for a lot of people because it has to go so far back. If you try to shorten it to eliminate that, then you're going to lose a lot of that suction cup effect I was talking about. And then you've got gravity working against you, so this may not even stay in place. You're going to have to use adhesives and things like that if we can't get that posterior palatal seal. The other thing is your tongue's going to be in constant contact with this material, so it's going to alter the taste of foods. One, because of the material, and two, because of the bacteria that this material is going to harbor over time. So the tongue is going to be in constant contact, and it's going to change the taste of your foods. Now, on the lower arch, this is always the more difficult one. So again, this is my mouth. We're going to digitally remove all of the teeth, and then we've got this ridge, and if you can imagine over time, this ridge is going to resorb. In some of the other videos, I've explained to you how a denture, it has this ridge lap. It just kind of sits over. Well, eventually, you're going to have to reline this, right? The bone continually resorbs. It goes away. And then at some point, when this is what we call knife-edged, which is kind of what they've tried to replicate here, just so you can have an idea of it, there's really nowhere for this thing to sit. I mean, if you saw what this looked like in the mouth, if you can imagine your lip is here if you pull it out, and then back here is the floor of the mouth. So when you look in the mouth, you've got nothing for it to sit on but this little knife edge ridge, and there's nothing to hold on to it. So you basically have this lower denture that's been relined to where it's basically flat. It may have this little groove from where this ridge line is here, but then you're going to have what we call a floating denture. I mean, it's just going to be sitting down every time your lip or your tongue moves or you try to talk. There's not going to be any support for it.